Okay, my name is Dr. Duffy. I'm a professor and psychiatrist in the Department of Psychiatry at Dalhousie University. I've been spending 15 years now studying the children of parents who have been diagnosed with bipolar disorder. The reason that we would want to study children who have a parent with bipolar disorder is because bipolar disorder, like many major psychiatric illnesses and like many major medical illnesses, has a strong genetic basis. The findings from this study have been really important and have been noticed worldwide. Essentially what we found are the potential clinical stages of illness early in the course. And what this means is, with this research, we'll be able to identify and diagnose children developing bipolar disorder much earlier in life, and presumably then the treatment should be much simpler, and perhaps we can offset the progression of the illness and the associated morbidity and early mortality. What we found actually is that bipolar disorder, like many other illnesses, starts as very non-specific clusters of symptoms and then coalesces and evolves over development into major mood episodes and finally into the full disorder. This lends itself to not organizing the existing information that we have about the illness, but it also looks like there's critical stages which we should be focusing on to identify and intervene early. Presumably, there should be stage-specific treatments, and that these treatments should be simpler and more effective. And the idea here would be, just like in this diagram, this is actually a grant proposal I'm working on to continue these studies, that things go from very broad to very specific. And currently we're diagnosing the disorder at the end stage, and what I'm saying is we want to focus our clinical and our research efforts to identify kids at risk early on. This work really also is relevant to how we should be organizing clinical care. Currently, we're stretched. We're just trying to keep up with the demand of patients coming through the doors of the emergency, and we really should be developing very specialized services of surveillance and of early intervention, and we should be following these kids through the high-risk period, through adolescence and into early adulthood. So we really need to do a lot of work in terms of organizing clinical care in the way that would benefit the people who are developing the